Hey, clinical folks, so I'm going to walk you through the case of Martha, which is a rational emotive behavioral therapy case. So Martha's 23 years old, she's female, and her presenting problems or symptoms, she's very self-punishing and compulsive. She's afraid of males, and she feels like she has no goals in life. And on the common one, unfortunately, is guilty about the relationship with her parents. So her father drank and was addicted to narcotics. He was in AA. And when he didn't have his pills, he was unbearable to be around. So obviously problematic for their entire family. So in terms of her social history, she had two brothers. One of them had polio. One of them had an enlarged heart. Her mom had a breast cancer and had a mastectomy. So she has a history of like everyone in her life having mental or physical health problems, right? Her family was hardcore Baptist, which obviously influences your views. She moved out of her house and was unmarried. Her parents judged her because of that. Parents never accepted any of her relationships, and she did go to college. She went to U of Illinois. Now, in terms of therapy, it was 4 sessions, then 1 later. She also did group sessions and then came back over the years. And in REBT or CBT, we call these maintenance sessions. The client can come back to brush up on their skills, or if new things arise in their history. So the big thing that they did in therapy was making her question what she was telling herself. This is really the linchpin of both CBT and REBT. Think about your thoughts. It's sort of meta in that way, and challenge them. The therapist really encouraged her to see she was making progress in therapy, taught her full acceptance of herself. He did bring up her dreams, but he focused on the emotions within the dreams, and he showed unconditional acceptance. So here you can see how some of the modern therapies really start to pull from all of the previous therapies, right? We've got this unconditional acceptance that we had in client-centered. We've got thinking about dreams, but in a different way from psychoanalysis. So we've built on what we've learned so far. Her strengths, she was really quick to learn from therapy. She modified her behavior between the first and second session. This is not that unusual for people who come to therapy to get really motivated and start changing. She was an honor grad. She was Phi Beta Kappa, which is a really big deal. She got better at managing the problems by herself. She was a successful writer, and by the end, she had almost fully accepted herself, which is, I think, way more than most of us could say, right? Now, in terms of difficulties that emerged in therapy, she had physical ailments that led to financial difficulties, so therapy was on hold for 9 months. Unfortunately, things like this happen with clients all the time, where they have something come up and they might just disappear from therapy or let you know, I can't do therapy right now. The clearest example I can think of is I had a client who was active duty military. He was a reservist. When I was at the VA, we had like a partnership with the local base, and he was going to get deployed again. He had very severe PTSD, but he told me that's what keeps me alive when I'm over there. That hypervigilance that comes from PTSD is what keeps me alert. And so I, in good conscience as a therapist, couldn't be like, yeah, let's fix that for you right now. Instead, I talked to him about when he returned from deployment, finding a therapist and going through therapy. Martha had difficulty dealing with the way her family perceived her. She felt emotionally blackmailed. They were trying to teach her how to live for herself, which again is really difficult for a lot of people. Now, the effectiveness of treatment, the result, it lasted for a prolonged time. It changed the way she viewed her philosophy of life. She took the advice Ellis gave her to heart and used it for an advancement. She ended up happily married with 2 kids, writing and truly accepting herself, and obviously had learned to overcome her fear of men. So just a quick overview of the case, and I'll have other videos for you all walking you through things.